Pain. Who hasn't felt pain? It can be emotional, psychological, or physical. It has been described in many ways: stabbing, shooting, burning, persistent, aching, throbbing, dull, and sharp. While there are many types of pain, I will be talking about chronic pain. In 2018, the Center for Disease Control estimated 50 million Americans suffer from chronic pain. I will begin with what chronic pain is, then examine how lifestyle medicine can help you manage it. Things to avoid: tobacco, alcohol, and opioids. Things that help: exercise, stress management, relationships, sleep, and nutrition. By the time you have watched this video, I hope you understand what you eat, think, feel, and do can help you manage your chronic pain. The International Association for the Study of Pain says, pain is an unpleasant, sensory, or emotional experience associated with actual or potential tissue damage. If you were told it's all in your head, you might be offended. But brainimmune.com says chronic pain is an evolving concept. Much of what you feel is based on a mental preconception. Not that you're imagining it, just that it's complicated and not currently well understood or managed with conventional medicine. The National Institutes of Neurological Disorders and Strokes says acute pain is your body's warning system to let you know of possible injury or the need to care for the injury. Chronic pain, on the other hand, persists long after the danger's gone or the injury healed. While there are many causes of chronic pain, it's beyond the scope of this discussion to go into detail. I believe it's fair enough to say that many people deal with chronic pain and suffer on a daily basis, so let's learn how to manage it. Are you controlling your pain with prescription drugs, tobacco, or alcohol? The American Medical Association says 40% of adults had been prescribed opioids in 2015, that 47,600 deaths were linked with them, and their use in chronic pain is not evidence-based. They are best used after surgery or for acute pain. 96 randomized control studies of more than 96,000 patients found their ability to control pain reduced after just a few weeks. The National Institute on Alcohol Abuse and Alcoholism says that while alcohol has been used since ancient times, and that 28% of people use it to control their chronic pain, they may be doing more harm than good. Alcohol and acetaminophen can lead to liver failure. Mixed with aspirin, it can cause gastric bleeding. Combined with opioids, it raises the risk of overdose, and that chronic alcohol use leads to increased pain sensitivity. The Cleveland Clinic, in Why Smoking Will Worsen Your Chronic Pain, explains that while nicotine tricks the body into releasing dopamine, the feel-good chemical, it also impairs blood flow to bones and tissues and is linked with slower healing times. Enough about what to avoid. Let's discuss how lifestyle medicine can help you manage chronic pain. Dr. Stephen Richeimer, in his book, A Pain Doctor's Guide to Relief, Confronting Chronic Pain, explains the benefits of exercise to alleviate chronic pain include decreased pain, increased energy levels, improved mood, enhanced joint health, better quality of life, and weight control. He cautions, talk to your doctor before you begin. Start slowly, move at your own pace, try to be consistent, accept some days will be better than others, and don't overstrain. For years, the standard prescription for pain was inactivity and rest. In Physical Activity and Exercise for Chronic Pain in Adults, they found that out of 381 studies, including 37,143 people, comparing exercise to non-exercise, there were few adverse effects to including exercise in their daily routine. In fact, they concluded that physical activity improved the severity of pain, physical function, and led to a better quality of life. The American Academy of Pain Medicine recommends combining stretching, strengthening, and cardio to relieve your pain, noting walking and swimming are a good way to start. In Chronic Pain and Chronic Stress, two sides of the same coin, the authors argue that pain and stress share physiological overlaps in that they both upset homeostasis and that they share a behavioral model that fails to rid itself of negative memories. Both stress and chronic pain decrease the quality of life, with stress exacerbating pain and pain causing stress. WebMD offers the following tips to alleviate chronic pain by managing stress. deep breathing, meditation, mental imagery, listening to music, biofeedback, massage, or simply distracting yourself. A breathing exercise I like is from Dr. Herbert Benson's book, Relaxation Response. You can also find his video on YouTube. The Common Health of Virginia offers relaxation techniques for stress relief. In addition to the tips already offered by WebMD, they suggest yoga, which involves a series of both moving and stationary poses combined with deep breathing. As well as reducing anxiety and stress, yoga can also improve flexibility, strength, balance, and stamina. The Merriam-Webster Dictionary gives us the following definition of Tai Chi: an ancient Chinese discipline of meditative movements practiced as a system of exercises. In addition to these stress management techniques, I would add having a cup of tea or taking a bath, or maybe both at the same time. Chronic pain affects almost every aspect of your life. Dennis Thompson Jr. explains, chronic pain affects relationships. He offers the following advice in dealing with your partner, children, family, and friends. I think the main takeaway is that you have to be honest with yourself and communicate with those close to you. Be reasonable about your expectations of what you are capable of doing and learn to ask for help. Another important tip is to try not to cancel plans with people. Isolation can only make it harder to deal with chronic pain. Sometimes it's important to find support outside your circle of relationships. The American Chronic Pain Association explains that support groups offer validation and education along with life skills. That many support groups are ran by members and they understand what you're going through. They point out that these groups don't necessarily focus on symptoms and treatment, but rather on supporting and encouraging you to create a better life and help you manage your chronic pain. They also offer information on finding a group near you or help with starting your own. The National Sleep Foundation reminds us that those who suffer from chronic pain are more likely to suffer from sleep loss. They say pain is related to stress and poor health. In fact, 65% of people with no chronic pain report a good night's sleep, while only 37% of those with chronic pain can say the same thing. People with chronic pain feel less control over their sleep and report that lack of sleep interferes with the quality of their life. Since sleep is an indicator of overall health, those with chronic pain must make an effort to ensure that they get adequate and restful sleep. People with chronic pain worry more about the lack of sleep affecting their health and exhibit a greater sleep sensitivity. They're more likely to say environmental factors like noise, light, and temperature interfere with their sleep. In order to make sleep a priority, try limiting caffeine and alcohol, use painkillers or sleeping pills only with the supervision of a doctor, practice relaxation techniques, and have a bedtime routine. It must be said, though, that sometimes if you're not having luck with any of these or you suffer from sleep apnea, it's time to see a professional. I saved nutrition and diet until last because I imagined it would be the easiest of all. After all, my degree is in nutrition and dietetics. However, I find this not to be true. There is a plethora of dietary advice surrounding chronic pain and inflammation, but it seems to be conflicting. Even the medical studies, a lot of them done on rats, seem to come up with results that cannot be replicated. I would say in general, there are a few things they all agree on. 1, including more fruits and vegetables and excluding processed foods and sugar is a good idea. I would say, after looking at many resources, both medical and lay, the only diet I feel comfortable in recommending for chronic pain is the same one that the American College of Lifestyle Medicine recommends for general health, the whole foods plant-based diet. They recommend eating a wide variety of fiber-filled, nutrient-dense foods from a rainbow of fruits, vegetables, beans, and grains. Michael Pollan, an author, activist, and journalist, professor at Harvard and Berkeley, sums it up in this way: eat food, not too much, mostly plants. His 7 rules for good eating can be found at WebMD. The American College of Lifestyle Medicine explains, lifestyle medicine is the use of a whole food, plant-predominant dietary lifestyle, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and a positive social connection as a primary therapeutic modality for the treatment and reversal of chronic disease. To finish off this video, I'm going to keep it short since I hope I already made my case. I hope you will try to use these core competencies to manage chronic pain and improve the quality of your life.